So, hi everybody. This is chapter 37. This is preparing for examinations, and this is for MA100 week 4. This is the micro lecture and PowerPoint lecture for this chapter 37. So, if you can go grab a pen and paper, I want you to take some notes. This stuff is going to be really, really important. You're going to be doing this every day. So, let's follow along, and I'll try to keep it short and sweet. I'm going to be explaining the MA's role in patient preparation, um, in positioning, gowning, draping. I'm going to explain the purpose of each. I want to discuss the MA's role during recurrent clinical visits. This is going to be important. Um, we're going to utilize proper body mechanics when we're transferring patients. We're going to explain breaking down a room, that's what we call it, and cleaning up a room, prepping a room for the next patient. I'm going to describe the methods of assessment used during the medical examination and how the MA assists the physician during medical examinations. And I'm going to talk to you about how to properly instruct your patients and how to communicate effectively with them. So we're going to talk about different positions. We're going to talk about role playing with physicians. We're going to talk about a lot of different things in regards to your communication with patients. This is a critical chapter in your instruction. If you don't get this right, you're going to get written up. We are held to the same account as nurses, as physicians' assistants. This is where your professionalism is going to really come into play. So I strongly suggest that you get a pen and paper and make sure that you are taking notes and you keep these PowerPoint lectures because these are going to be important. What I'm about to show you and go over with you, again, it can make the difference between getting a dollar raise, a quarter raise, no raise, written up, or terminated. So I take this stuff very seriously. Um, if there's breaches in these protocols, you are going to be held accountable, not the person before you. If you were the last person in a chart and you make a mistake, you are going to be held accountable. If you are the person that is running a patient, again, I want to reiterate to you guys, the patients will discuss with the doctor anything that they don't like that you said to them, or if your interaction with them was anything less than 1,000%, the doctors are going to know. And that means your practice manager is going to know, or your office manager is going to know. And that could potentially mean that human resources could know. So maintaining professionalism is critical for these next two chapters. So what are we talking about here? We're talking about preparing the room, first of all. Before a patient ever gets into the examination room itself, every room has to be clean and well organized and at a comfortable temperature. 72 to 73 degrees. You're going to have geriatric patients that are on blood thinners, and they tend to run cold. Blood thinners, Coumadin, warfarin, any of those things that you take to kind of keep you from getting a stroke from atrial fibrillation, AFib. Um, your geriatric elderly population is always going to be cold. In July and August, in 96-degree heat, they're going to walk into the office wearing a sweater and maybe even a jacket. And you're going to be melting and you're going to wonder, how can this possibly be? The older that you get, you tend to run cold. So you don't want to ever make sure that your air conditioning is set so high that people are freezing. Again, remember their comfort. It's already nerve-wracking going to a doctor's office, and a lot of physicians will require the patients to disrobe and gown up, putting on an examination robe. You're already vulnerable, so don't be cold and vulnerable. Try to remember to keep your patients comfortable. You want to make sure that all the supplies and equipment are ready for you that you need. Don't walk in and start rooting around and looking for something when a patient is in the room already. That should have been done prior to a patient walking in the room. New table paper every time, every patient. Do not ever walk into a patient examination room and let me find wrinkled, ratty, dirty, previously used table paper. I will write you up. If you do that in my facility, that is a write-up because that is not sanitary, especially in an era where there could be potential viral infections. We have to make sure our rooms are completely disinfected. A dirty paper table shows your patient coming into the room that this is not a well-run oiled machine. It's gross. Please don't do that. Again, how would you feel if you walked into an examination room with your parent or your spouse or your child and the room was dirty? There were dirty caps from needles from a previous examination. There was PAP equipment still sitting out. No, thank you. Please use your common sense. Break down your rooms in between patients and disinfect everything. Your thermometers, stethoscopes, blood pressure cuffs, the table itself, doorknobs, chairs, anything that everybody's touching, disinfect every single time before every new patient comes in. You want to make your patients feel as comfortable as possible. So you want to make sure you're giving your patients direct instructions. Instruct them how to wear the gown and apply the drape if it's for a female. A male for a physical or an annual wellness visit. Sometimes the doctor will say, leave your underwear on, just gown up. Okay. Whatever your physician wants, you need to ask. Don't just sit there quietly. Ask the physician, how do you want your patient ready for you when you go in? Some doctors, and I've worked with all different types, some doctors don't care. Some doctors are like, stay in your clothes. I have a lot of physicians, though, that I've worked with and I'm friends with that will say everything off, gown on. Whatever your doctor's preference is how you're going to go from there. Please make sure ahead of time so you don't get in trouble. If you have to get a urine specimen, the very first thing that you should do, whether the doctor wants it or not, if they're there for any kind of a bladder issue, try to collect a urine sample if you feel like they're coming in because of a UTI or they have a kidney problem. Get it, label it, and hold off on it. If the doctor needs a culture or a urinalysis, it's already done. And make sure we're using our proper body techniques when we are moving. You don't want to injure yourself. You know, there's a epidemic of obesity, and if you try to move a patient incorrectly, you will hurt yourself. So proper body mechanics are very important. These are some of the examination positions that I want you to get aware of. There's the anatomical sitting, there's horizontal, there's dorsal recumbent, there's prones, there's Sims, there's the knee chest, Trendelenburg, Fowlers, semi-Fowlers, lithotomy, or your jackknife. Now, some of these guys on the right are more for specialty practices. If you are working for a colon rectal surgeon, OBGYN, gastroenterology, those kind of things are going to be more specialized to these specialists here. To the left are the more general practice, family practice, PCP kind of positional situations that you're going to find when you are prepping a patient. And then again, it depends on what the patient's there for. If it's a female patient, and they're there for their annual PAP, which can be done in a PCP's office, then you're going to want to prepare the table in a lithotomy position. So it is going to be incumbent upon you to know these positions. So these are important. Inside your Cengage ebook, there are different diagrams, and I'll show you some of them coming up here, but these are important to memorize. So you need to make sure that you know and you use these terms correctly. So if your doctor says, I want this patient in dorsal recumbent, you best know what he's talking about. Because during the day, when a physician has 80 patients to see, they're not going to have time to explain the world, the way of the world to you. You need to know these things. So study these examination positions and memorize them, because you best know that you're going to be putting a OBGYN PAP patient in lithotomy, and if you work for a colon rectal, you're going to have different anatomical positions and examination positions. So get to know them intimately. Here's some of those examples I was talking about. That's obviously your horizontal. This is going to be found basically in like clinical situations, hospitals. If you work inside a hospital, that is really how you're going to see most of your patients. This is another one. I'll give you a couple more examples here. Let's see. So here's another example of prone and Sims. These again, More for colon rectal. If you have to place a suppository in a patient, these are some of those examination positions that would be available. Again, these knee chest, this is for, again, your colon rectal stuff, bowel preps, any kind of those kind of things. And then the semi-Fowlers, this is also, you can be in a doctor's office, you'll see this quite frequently too. And remember, your semi-Fowlers is 45-degree angle. And then your Fowlers, lithotomy. This is for your PAP, okay? If you have an OBGYN patient, those little handles, those stirrups that we call them, they need to be out and ready, okay? Some of them have little slip covers to keep them from being super ice cold. My grandfather was a physician, and he always tells me to keep your stethoscope inside the pocket of your scrubs so it stays warm, because people don't like when you put a cold stethoscope on them. So I don't do that, but I usually apologize in advance and I say, I'm really sorry if this is cold. So just let them know, be aware that instruments may be cold. These are those Trendelenburg or shock positions. These are actually not really in use much anymore. There's been some data. You're not going to ever really see these in practice. These are really more the modified and the regular shock position, Trendelenburg positions. I've not seen them very frequently as a MA. So these are more highly specialized positions, post-operative positions, more found inside of a hospital clinical situation. Still, though, you need to understand what those mean. This is to pull blood away from the lower part of your body and up into the vital organs. There's certain reasons for that. There's different modalities as to why you would be in the shock position. So you need to be made aware of this regular one and then the modified, which is the 90 degrees, feet are at a 45-degree angle up and elevated. Put a regular patient now is a lot of the doctor's offices, if you work for colon rectal, they have chairs that are almost like $200,000, but they will actually place a patient in this position for them. You even have to explain it. It's like a big robot chair. It's like Transformers. You sit down, and all of a sudden, you're in the jackknife position. It's amazing, and I'm here for it. But you still need to explain prior to going into these crask or jackknife positions what's happening. You don't want to tell a patient, sit down and then have the chair move into this position. You're going to freak people out. So what I'm trying to tell you is, again, before you touch a patient with an instrument or anything, you're always going to be explaining what you're doing. Before you walk up on someone, you say, I am going to take an oral temperature from you. I'm going to take your blood pressure. I'm going to take your height and weight, and then proceed to do the procedure. But don't ever walk up on somebody and start doing something. That's a quick way to get a split lip. Don't walk up on people. Some people are jumpy. You may have PTSD patients. Explain in a calm way what your intentions are before you ever touch a patient. You have to maintain and receive that verbal authorization and consent. So explain your position to your patient, okay? Find out from your facility what they want you to do. Again, my teaching and instructions to you guys is more like laying the basement foundation of a house, right? It's going to be up to you and the facility that you work at to kind of decorate it and get it how you want. But these are just some of those generalized pieces of information that you're going to need to know. So let's recap quickly. I want you guys to understand the differentiations in all of those positions that we just went over. So you can stop these on each frame and look at them in your Cengage ebook. You're also going to see in Chapter 37 and Chapter 38 more detailed explanations to these positions. So thanks a lot, and we'll continue in a minute.